Ethiopia has taken measures over the last decade, rising in global rank from 146 in 2000 to 68 in 2012. UNICEF's 2013 Progress Report on Committing to Child Survival, A Promise Renewed, which examines trends in child mortality since 1990, analyzes the main causes of under-5 deaths and highlights national and global efforts to save children's lives. Efforts to deploy health workers to even the most remote parts of the country have partly contributed towards progress. The government and its partners have enabled mobile health workers reach residents in remote parts of the country like Okura village, located by the Baro River in southwestern Ethiopia. During the rainy season, the village is largely cut off, accessible only by river transport. But now people are able to get services from community health extension workers. Health workers like Abang Obio visit residents to check on immunization records, test for diarrhea, pneumonia and malaria, and monitor hygiene in homes. Certificates are also awarded for model homes, households that adhere to good health habits like washing with soap and using insecticide-treated bed nets.
Before, a lot of children under 5 years used to die because of lack of knowledge about good health. Now I try to educate and change the community to reduce death and illness among children under 5 years of age.
More money is being spent on health care. As a result, poverty levels and mortality rates are now down, and twice as many children are in school. African leaders made a strong commitment earlier this year to prevent child deaths, putting child survival at the forefront of social development agendas across the continent and renewing the focus of African leaders to head their own countries' efforts. Sub-Saharan Africa still accounts for the majority of child deaths, however, and high rates of preventable child disease and death persist despite simple, affordable and high-impact interventions. Throughout Ethiopia, there are about 38,000 health extension workers who go out to various communities.
Reasons why my brothers died is because at the time there was no health facility, but now there is a health centre, a health post and a health extension workers. They take care of everyone who goes there and they give you medicine.
In 1990, the under-5 mortality rate in the country was one of the highest in the world at 204 per 1,000 live births. By 2012, this rate had been slashed to 68 per 1,000 live births. More children are now thriving beyond their 5th birthday, and the parents are having fewer children.
I never thought this change would come 5 years ago. Now I tell you, if one works with perseverance, I think you can bring change. Even if we are very poor, we can still bring radical change, I tell you.
UNICEF says that Ethiopia reduces under-5 mortality by 2/3 between 1990 and 2012, the required reduction for meeting the target of the UN Millennium Development Goal 4. Dr. Kesete Berhan Admaso is Ethiopia's Minister of Health and says the government has a policy of reaching the hard-to-reach parts of the country and promoting responsibility among individual families.
With that commitment and with the commitment of the government, in putting actual money, real money, beyond setting the policies and so on into the program, has helped to attract more donors to the program.
Rwanda and Liberia have also made dramatic gains, lowering their under-5 mortality rates by more than 2/3 between 1990 and 2011. African countries are being encouraged to develop and implement country-led roadmaps that integrate efforts to end preventable deaths among children under 5 by 2035 and reduce the mortality rate for children under 5 to below 20 per 1,000 live births.